So, there are many effects of obesity, bad effects on your health. One of the major affected process as far as obesity is concerned is the metabolism. It leads to dyslipidemias, that is the lipid metabolism is affected, glucose intolerance, that is the glucose level remain elevated in your blood, insulin resistance, that is type 2 diabetes. We have talked a lot that your insulin is not being responded by your cells. Your cells are not responding to insulin. They are resistant to actioning of the insulin. As a result, you have hyperglycemia. The affected organs, of course, liver, because liver is the major organ involved in the fatty acid metabolism. So, if you are obese, you have more accumulation of lipids. Of course, the organ which is most involved in the metabolism of lipid, that will be affected, and the liver is here the first. Then there are skeletal muscles, because liver the deposition of lipids also affect your muscles, and then the adipose tissues, because these are the major tissues in which the fatty acids are deposited. Then one of the major reason that these abnormalities occur is because of the signaling which is originated by the adipose accumulation of fats in the adipose tissues, the initiation of signaling, the occurrence of inflammation, the inflamed tissues, they all worsen the condition. But not all the obese people have these symptoms. Of course, from the inner side, I mean, their body is affected because of obesity, but they may not have these symptoms of these abnormalities. Then this obesity is linked to metabolic syndromes or metabolism or defects in the metabolism by different ways. One is that it, as I mentioned, it leads to the hyperglycemia because of the insulin resistance. It also leads to hyperinsulinemia. Why hyperinsulinemia? Because your body is not responding to the insulin. There is more and more production of more and more accumulation of the glucose in your blood, which in turn gives the signal to produce more and more insulin, and your blood have more and more insulin in your body also, which again is not less harmful. Then also, as I have dyslipidemia, I have already mentioned that there are high LDLs, low HDL. You know, HDL is good, considered good for health as compared to LDL. And then there are elevated triglycerides, also leads to high blood pressure, hypertension, more accumulation of lipids because of obesity. Of course, you will have cardiovascular diseases. The risk is increased tremendously. And then there is, of course, because of this accumulation of fats in the adipose tissues, in the muscles, they all leads to inflammation. Many inflammatory responses are elicited, and it leads to the worsening of the condition. The adipocytes release many pro-inflammatory mediators like interleukin 6 and TNF alpha and other factors which increase the effects of the inflammation, which worsen the already deteriorating situation. Then low levels of adiponectin also. I mean, adiponectin is involved in the regulation of lipid metabolism. In addition to doing other things, one of the major things it does is it regulates the lipid metabolism, and also it regulates the insulin level in your blood. So, if the concentration or if the expression of adiponectin is affected, it lowers. If it gets lowered, it will ultimately lead to the imbalance in the level of insulin in your blood, which will ultimately lead to the accumulation of glucose, which of course cause all sorts of problems. Another very important thing is that non-alcoholic liver disease. We have told you that liver is the most affected organ when it comes to the abnormalities caused by obesity, because there is diabetes, type 2 diabetes. Type 2 diabetes put liver under strain because there is more and more lipolysis and more production of fatty acids. Then liver have to work more than its ability to do, and also then there is accumulation of lipid droplets, lipids into the liver, which leads to hepatic steatosis, and it increase the risk of non-alcoholic fatty liver disease. So in that way, if your liver start getting compromised, it's one of the most dangerous and lethal signs for your life. I mean, you can somehow think of an organ which is central to your metabolic activities, and if it's functioning, if its activity gets compromised, how harmful it can be for you. So that's why we say that obesity is the diseases of diseases, and this slide will show you that how much risk factors are associated with obesity: type 2 diabetes, dyslipidemia, hypertension, cardiovascular diseases, cancers even. And we will see that how cancers is related with metabolism and defects in metabolism. Gallstones, your gallbladders have stones, arthritis, gout, again like arthritis, it's your limbs have very severe pain, pelvic floor disorders, you name it. I mean, when you are above 50 and you are obese, you should get yourself ready to deal with these associated risks with obesity. So it must not be difficult for you and for me too, that how important it is to lose your weight. It reduces your blood pressure, it lowers your triglycerides and blood glucose level, and I need not to tell you why it's so important. Increase HDL. So this is the benefits you get when you lose your weight. What could be the methods for reduction of your weight? Of course, you decrease energy intake. I mean, don't eat the junk food, don't eat the energy drinks. Increase your physical activity, change your dietary style, your lifestyle also. You should not sit much, you should not eat all the time. And then there are medications also, surgery also, but I would say the first part, that's key components of weight reduction, you should focus more on that. And there are challenges in weight maintenance also. I mean, you can see me when I started this course, I thought that I will reduce my weight, and I thought that with the passage of time from the lecture number 1 till the very last lecture, I would have reduced my weight tremendously, or at least significantly. You can see that it didn't happen. Or did it happen? Tell me. So the challenges are vigilance is required, and you have to be very vigilant. And also, once you reduce your weight, you regain it again, because you stop being vigilant. You can be acting very vigilant for 1 month or 2, and you start getting lazy again, and your weight then again is gained. And when it gets gained again, it is much more rapidly than it was gaining when you were gaining it before. So you have to keep in mind that it's not a process of a day or 2 or month. It's a continuous process of showing vigilance, showing care for your health, because your health is your life.